Welcome to Module 7, Tools, Templates, and Process Facilitation. In this module, we'll explore practical tools and systems that help local health departments work smarter, not harder, when it comes to CHA and CHIP. Our focus is on creating structured, inclusive, and repeatable processes that support equity, efficiency, and FAB alignment. You'll walk away with ready-to-use templates, meeting guides, facilitation strategies, and digital tools to make it easier to organize your work and engage stakeholders. So let's get started. So first off, having the right tools and templates saves time, builds consistency, and helps new team members quickly get up to speed. These resources are designed to provide structure for CHA-CHIP meetings and milestones, reduce duplication of effort, create documentation that's FAB ready. And whether you're facilitating your first focus group or preparing your 5th CHIP, templates make your work smoother and more sustainable. A good CHA-CHIP meeting toolkit includes everything you need to run efficient, goal-oriented meetings. You'll find sample agendas tailored to each stage of the CHA-CHIP cycle, planning worksheets for prioritization, root cause analysis, and strategy mapping, templates for note-taking, reflection prompts, and decision documentation. This type of toolkit helps you stay organized, make meetings more participatory, and ensure clear follow-up and accountability. It's especially helpful when onboarding new staff or rotating facilitators. So tracking who's involved in your CHA-CHIP process is critical, especially when it comes to equity and documentation. The Partner Engagement Tracker helps you monitor who's attending meetings, record organizations represented across assessments, identify underrepresented voices and target outreach, and track engagement across time to sustain involvement. This tool also supports FAB domains 4 and 5 by providing a clear record of meaningful multi-sectoral participation. Ultimately, you want to be able to keep track of all the people that you're working with, and having something like a downloadable Excel file is sometimes a really useful tool for that. So checklists and planning grids help make sure nothing falls through the cracks. This includes like having a kickoff checklist to guide internal readiness before launching the CHA, or an assessment checklist to ensure you've completed all 4 MAP 2.0 assessments and you have the key items that you were looking for. A planning grid that links priorities to CHIP strategies, performance measures, and responsible parties. These tools help you visualize your progress, clarify next steps, and stay aligned with MAP, FAB, and equity goals. Effective facilitation brings structure, energy, and inclusion to your CHA-CHIP process. Some facilitation resources might include a facilitation guide for CHA planners with tips for managing group dynamics, surfacing equity concerns, and supporting decision-making. Having pre-prepared questions, timers, and decision tools to make meetings smoother. Reflection exercises to help participants close meetings with intention, like asking, what did you hear today that surprised you? For even a well-written CHIP can fall flat if the process leading to it wasn't participatory. Good facilitation helps bring your tools to life. So for those of you planning your CHA, here's kind of a guide. You want to make sure you set clear goals and time blocks. Try to rotate your speakers and moderators. Sometimes having different people talking helps kind of shift the attention and keep people engaged. Use interactive tools like dot voting or strength, weakness, opportunity, threat, SWOT boards, or card sorts. Consider using liberating structures or the top methods, so different methods and frameworks that you can do in facilitation. And plan how you'll listen, not just talk. It's really easy when you're putting something together to say, this is what I'm going to say, this is what I'm going to do, this is how it's going to work. But you also want to build in the capacity to hear what people are saying. So one of the most popular methods here in Nebraska, there's a lot of places that are using it, is the technology participation method. It's a structured facilitation approach that helps diverse groups engage in meaningful, consensus-driven dialogue. So try to avoid the domination of the vocal, confident, comfortable people in the room, and try to extract more information from the people that are a little more hesitant to communicate that way. It's a focused conversation method. That's one of the key tools. It's great for guiding reflections, unpacking complex data, or debriefing after community conversations. The consensus workshop method is ideal for setting priorities, building group alignment, and generating strategy ideas. TOPS works well because it encourages equal voice, reduces domination by more vocal participants, and leads to shared ownership of outcomes. It's especially helpful during visioning sessions, ship strategy development, or focus groups, but you can use it in all kinds of different ways. If you're looking to deepen community engagement and improve decision quality, this is a facilitation method worth exploring. So clear meeting agendas and facilitation tips keep your CHOT process focused and productive. The slide offers sample agendas for kickoff meetings, focus groups, prioritization workshops, and shift strategy planning. It's a structure that builds from check-in to purpose, discussion, action items, and reflection. Some prompts that you might use, they might look like, what did you hear today that surprised you? Or what's one idea you'll take back to your team? Ultimately, what you do is going to be really dependent on the group you have and how you want to structure the tables and the dialogue and breaks and whatnot. But this is just an example of something that you might do. It's just important to make sure that you're breaking it down. So digital tools can also increase efficiency, expand participation, and strengthen your documentation. So there's a lot of options out there. We live in a digital world now. So I just listed a few here. I'm not very familiar with Airtable, but it came up a lot when I was looking around at things. It's good for engagement tracking. And talking about free tier limits a lot when I was looking at it. My sidewalk's very common in Nebraska. I don't know about the access, but there is a cost to it, but I don't know if that cost is going to remain where it's at or not. But that's for public dashboard development. It's relatively straightforward for getting put together. You can use things like Google Docs to organize your notes, your planning, documentation. It's free, it's collaborative. The way the security is set up, you just gotta be very thoughtful about how you provide access. Excel is just a software tool for tracking, scoring. People are very familiar with it. It's exportable, been used a lot, so it's very adaptable to what you need. But there's so many things out there. You got Microsoft Teams now and Google Drive for real-time collaboration and version control. Trello or Asana for project tracking and deadline management. Otter AI or Zoom transcripts to capture meeting notes. Jamboard or Miro for visual brainstorming in hybrid or remote settings. Tableau and Power BI or other softwares for data visualization and dashboarding, kind of like my sidewalk. There's also open source stuff out there that you might consider exploring. So kind of touched, like I said, this is just a primer into all these things. There's so much more depth that we could go into. But I just wanted to kind of look at how some Nebraska health departments are putting shared CHA tools into action. So one regional CHA, through one health district, but across a very large region, was North Central District Health Department here in Nebraska, and they presented at the public health conference about their work. But ultimately, they had a My Sidewalk dashboard that has all the data in it. And they also, in that My Sidewalk dashboard, incorporated what they had from focus groups and what they had from key informant interviews. And then that kind of created this master template that they could use. And then they also had the meeting that they had with all of their key partners, where they shared kind of the convergence of this mixed methods approach to identify priorities. And I think it worked really well. It resulted in a streamlined planning process, a consistent community experience for all those stakeholders that were present, and a good cross-county comparison, and should be good for fab documentation. So overall, really great example of how they took a lot of different digital software, took advantage of a lot of person-to-person conversations, and converged on some priorities. I thought they did a great job. Lincoln Lancaster County Health Department also had a mixed methods approach. So they did a survey that they distributed, geospatial survey. And then they also did the same survey with kind of an equity focus with certain populations. And then they compared the results of those surveys across the full community and how they sampled by census tract, so the whole space was represented, and then also doing subpopulation analysis for those that they thought maybe we didn't hear from as well. We also did community conversations, over 40 hours of conversations in over 6 languages, facilitated meetings, and with communities that are underrepresented. So really kind of amplifying their voice. We did a minority health summit. It's been a while now, but it was about 5 years ago. And that identified priorities that were then used to weight the measures that were being prioritized so that they had more probability of being picked up for the Community Health Summit as priority areas. And overall, the Community Health Summit, where everybody comes together and prioritizes and gets started on the chip, had over 125 members from 70 plus organizations. So they took the facilitation, the digital, and created a mixed methods approach that led to good attendance, good engagement, and good thematic analysis that allowed us to identify priorities. So let's wrap up Module 7. We've covered a lot of things, but just very superficially. Like I said, there's so much depth in this area. The key takeaways are that structured tools enhance efficiency. I'm trying to provide you some resources, some standardized templates and checklists, streamlining the CHA-CHIP process, ensuring consistency and saving valuable time. I tried to present a little bit about effective facilitation driving engagement, with the TOPS facilitation method being the most common. Talked a little bit about digital tools supporting collaboration, so My Sidewalk, Google Docs, just Excel, just all kinds of different resources out there. Really, it's just about sharing and being on the same page. And then there were a few case studies about practical insights of, you do a survey, you have a digital copy, you have a physical copy, you do conversations, interviews, and then it all converges together to help you identify priorities. So next steps, please complete Module 7's quiz. There should be some downloadable handouts and tools available for you. I tried to get some Nebraska case studies. There's also a Minnesota Department of Health document that I wanted to share. So you should have access to all of those. And you might consider just looking at the tools and templates that were shared in this module, trying to make them for your jurisdiction. Use a planning grid. Try a facilitation strategy and reflection prompts in your community meetings. And explore some digital platforms that might be helpful. It's different for everybody, but just try to keep things usable, inclusive, and transparent. So Module 8, we'll talk, this is really something that's just designed for administrators for the training for CHA and CHIP. I thought it'd be useful just to have a brief overview about the training. So if you're interested in that, that's Module 8. And we'll get started on that next. And then some additional resources here. It was just the documentation about CHA-CHIP meetings and facilitation, and trying to have some of the tools on here for you as well.